During this rotation, I dealt with a few patients who had chronic pain. And this was mostly in pool therapy that the location I was at offers for patients. However, I wouldn't describe any of the patients I really dealt with to be difficult. I think there's a few reasons for that. The first being that a lot of the patients that I've met had been dealing with their conditions for quite some time, and they had found success in managing their symptoms to the best of their abilities with therapy or just with guidance of previous medical providers in all sorts of different settings. So when dealing with any of these patients, being that chronic pain is still something that is very new to me, I would definitely lean on the guidance of my clinical instructor whenever I did work with these patients. And I would even try to learn from the patients as to what they have found in their own history that has been helpful and what has not been helpful, whether it be with specific exercises or just types of therapy that they've had in general. A lot of the patients that I worked with were in the pool really liked pool therapy because it was a way for them to be able to exercise without having the full load of being, for example, like on land therapy. So I think for myself going forward from this class, something that I would like to learn is how to be able to take a patient that I might encounter in the future that is early on in their rehabilitation process or has possibly just been diagnosed with chronic pain, and be able to guide that patient to eventually end up at a point at which I saw many of the patients in this previous rotation where they had kind of found a place that was sort of stable, and even though that they still have their days that were very challenging, they also had days that were a lot better and were very fond of the treatment that they were getting from the specific location that I was at. And I think just in general, being more exposed to different forms of treatment for chronic pain, whether that be like actual treatment through exercise or like physical hands-on, or even the aspect of helping somebody deal with those mental battles that I have not had to do so yet. And I feel like that part is something that is going to be probably the most challenging, because even though I try to be as empathetic as possible with any of the patients that I've ever worked with, I think it's very difficult to put yourself in somebody else's shoes when you don't know what it is exactly that they're feeling, and how difficult some of the very mundane tasks that we might be able to take for granted in the day-to-day, and how difficult those things can become for somebody who has chronic pain.